welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I will be taking you all to explore the world of rare diseases. And my topic for today is Acanthocytosis Chorea. Now, to give an in depth knowledge about this, we have with us today Dr. Syamlal S., who is the group coordinator and also a senior consultant neurology at KIMS Health. So, welcome to Medical Dialogue, sir. It's really a pleasure to be interviewing you here today.
Hi, good evening, Nandita.
Great. So, sir, now that we're talking about rare diseases, we're talking about acanthocytosis chorea. We're going to discuss that in detail. Firstly, if you could just provide us an overview of this condition, its primary characteristics, and most importantly, the highlight of this series, that is why it is known as a rare disease.
Yeah, we will be discussing about neuroacanthocytosis. It is one of the rare movement disorders in neurology. It's not a very common problem as we usually encounter like a stroke, epilepsy or other neurological diseases. Neuroacanthocytosis is actually occurs, the incidence is around 1 to 2 per million. 1 to 2 per million. That means it's a relatively very rare neurological diseases. And the various manifestations of neuroacanthocytosis, as Dr. Nandita was mentioning, chorea-acanthocytosis. The main feature of neuroacanthocytosis is a movement disorder called chorea. What is chorea? Chorea in Greek means dance. It's an involuntary, abnormal, non-repetitive movements of the body parts. It can involve the face, or it can involve the tongue, it can involve the lips, or it can involve the body. This is called chorea. Chorea is the main presenting feature of neuroacanthocytosis. Yeah, it can be associated with other features as also. The main feature of chorea in neuroacanthocytosis is it is mainly perioral. Perioral means it's also called eating dystonia or eating chorea, and it will produce abnormal movements when the patient tries to take food, and it will produce self-mutilation of the tongue and lips. We can identify the patients of neuroacanthocytosis by looking at the face itself, because they will have multiple bites on the face and tongue with injuries around the perioral area. That is called eating dystonia. And another feature of the neuroacanthocytosis is hypersalivation and difficulty in swallowing. Hypersalivation, there will be excessive salivation in neuroacanthocytosis. And as Dr. Nandita was mentioning, it is a rare disease and it is an inherited disease. It runs in families. It has got an inheritance pattern of autosomal recessive pattern. Autosomal recessive diseases express when there is marriage between the relatives, like cousins, uncles. All these marriages will predispose to expression of autosomal recessive diseases. The main mechanism of neuroacanthocytosis is why it is called acanthocytosis. Acanthocytes are actually abnormal RBCs. RBCs are the red blood cells in the blood. They are usually oval shaped, but in neuroacanthocytosis, the membrane of the RBCs get disrupted and it will appear as spicules. It's called acanthocytes, neuroacanthocytes. Okay. And this mechanism behind speculation of the RBCs and the dysfunction of the neurological system is actually due to the abnormal protein formed by the neuroacanthocytosis patients called as chorein. It is related to chorea. This chorein protein gets deposited and it produces pathological dysfunction of the brain, and that will produce the abnormal movement disorders, chorea, and all these things. And also there are other conditions also which will produce acanthocytosis like presentations. Another condition which is much more rarer form of neuroacanthocytosis is called McLeod syndrome. It is actually an X-linked recessive disorder, which is specifically seen in a pattern of blood group of patients. And McLeod syndrome is associated with cardiac involvement as cardiomyopathy, and also it involves the peripheral nervous system and it will produce a peripheral neuropathy. These are all features of neuroacanthocytosis. And there are treatment options for the neuroacanthocytosis. Various drugs are available to control the chorea and the movement disorders, and also even we can do deep brain stimulation. That is a surgical procedure by implanting electrodes in the brain to control the abnormal movements. It's called deep brain stimulation.
Great. Definitely, that was a very good, crisp overview about what rare condition this is and what are the characteristics that one should be aware of. Now, if I may ask, you mentioned about the causes also about acanthocytosis chorea. If you could highlight that a little bit in detail, and if I may ask, how is it genetically? Is there any possibility of any genetic inheritance in this condition?
Yeah, I had already mentioned neuroacanthocytosis is an inherited disease. Inherited disease means it runs in families. The pattern of inheritance is autosomal recessive. The main type of chorea-acanthocytosis or neuroacanthocytosis is autosomally recessively inherited. As we all know, autosomal recessive diseases manifest when there is marriage between the marriage between the relatives. That will cause expression of the autosomal recessive diseases. So, neuroacanthocytosis is usually an autosomal recessive disease. But there are certain variants of neuroacanthocytosis which is X-linked. That is called the nucleo syndrome.
No, now, so we're talking about this condition in a little bit of detail. If you could just highlight on what tests are typically used to confirm its diagnosis.
Yeah, all the neurological diseases and movement disorders are diagnosed by clinical features and also by certain investigations like lab investigations and imaging of the brain. So, as I mentioned earlier, neuroacanthocytosis classically presents with the abnormal movement of the lips and tongues, can producing difficulty in eating, drinking, and all these things, and it will produce injuries to the lip and the tongue. It's called eating dystonia or orolingual dystonia. And along with that, the patient will have abnormal gait, that is difficulty in walking. It's also called rubber band syndrome, because patient will be jumping, dancing like that. That type of gait is called rubber band gait. When a patient with a family history and also other this consanguinity means marriage between the relatives associated with the orofacial abnormal movements and this abnormal gait, we will consider the possibility of a condition called neuroacanthocytosis. In blood investigations, we can look for the peripheral smear showing the RBCs. I said now, red blood cells are showing spicules. Red blood cells showing spicules. It will be more than 10% in case of neuroacanthocytosis usually. And also there will be elevated CPK, creatine phosphokinase in blood. These are the two investigations which will help to diagnose neuroacanthocytosis in blood. And also genetic studies. Genetic studies can be done in neuroacanthocytosis for confirming the diagnosis. And also we can consider imaging of the brain, MRI scan of the brain to see is there any structural lesions or abnormalities in the basal ganglia, because neuroacanthocytosis specifically involves the basal ganglia regions of the brain. So all these investigations, clinical features, blood lab investigations, genetic studies, and the MRI scan of the brain, all these will help to confirm the diagnosis of neuroacanthocytosis.
Great. Now coming to the next aspect, sir, you also mentioned about the treatment aspect of it. You mentioned that there are certain drugs which are available. So apart from that, what are the other management options for acanthosis chorea, and how effective do you feel are the current management protocols or the treatments that are available in slowing the progression of the disease and at the same time also improving the quality of life for such patients?
Yeah, neuroacanthocytosis, the main disabling symptoms, as I mentioned, is the chorea involving the face and the body parts. And this can be controlled by medications because there are certain medications called VMAT2 inhibitors like deuteraside. So many drugs are available along this category which will improve the tetrabenzene. All these drugs can be used for control the chorea. Also, neuroleptic drugs like D2, dopamine 2 receptor blocking drugs like so many neuroleptic drugs are available. Haloperidol, all these can be used to control the chorea. And certain Anti-epileptic medications like sodium valproate can also be used to treat chorea. And another group of drugs called amantadine. These are also can be used to control the symptoms of neuroacanthocytosis. All these medications in various combinations can be used to control the symptoms of chorea. Certain patients, even with these medications, will not show significant improvement of chorea. So, a newer treatment method is called deep brain stimulation. Deep brain stimulation. In deep brain stimulation, with the help of a neurosurgeons and together the neurologist, they will do an implant and electrode inside the brain. Implant inside the electrode inside the brain, and they will specifically stimulate the globus pallidus internus. Globus pallidus internus is a part of the basal ganglia system of the brain. Basal ganglia is that part of the brain which controls the movements of the body. So in the basal ganglia, when you stimulate the globus pallidus internus by the depth electrodes, you can abort the movements. So this is a newer treatment evolved in the treatment of neuroacanthocytosis. Like any pacemaker put in the heart, you can put a deep brain stimulating system in the brain, and you can externally control the deep brain stimulating machine. And by stimulating the globus pallidus internus in brain, you can abort or terminate the abnormal movements like called chorea or dance-like movements.
Okay. Now you mentioned about the treatment options, the current available methods that are required for management. Now, people nowadays talk a lot about physical activity, diet, and lifestyle modifications. So, if you could just give us an idea if there is any role of these three parameters. That do they play an important role in the management of acanthocytosis chorea?
Yeah, definitely. All these type of movement disorders are is a team approach. Usually, it needs a supportive treatments, because whenever you are having this abnormal movements and you are dancing without your will, it's not a good situation. So they need a psychological support, and they also need gait training. Gait training is usually done by the physiotherapy team, physical medicine team, or the physiotherapy team and rehabilitation team. They will help to have a proper gait therapy, and also assisted devices for prevention of fall, injuries, and all these things will be utilized. Because regular exercise, any healthy diet and regular exercise will improve the quality of life of any person. Like that, any neurological or degenerative or movement disorders patients will be benefited by a comprehensive team approach, including a clinical psychologist for mental support, a physical therapy and rehabilitation team, and also a dietitian to help a proper healthy nutrition to the patients. All these helps. It's a comprehensive team approach along with the medical management.
Okay, so correctly, as you mentioned, they all come under supportive management. Medical management definitely being the first line of treatment. All these parameters together will give you a supportive treatment, and that's actually essential. Also coming in lines of management. Now, lastly, Dr. Syamlal, if you could just highlight any recent advancements in research, or any article that you've come across, or any potential new treatment aspects that are open up for this condition.
Yeah, the very important latest treatment that I was mentioning, the deep brain stimulation. Earlier, neuroacanthocytosis was managed with this supportive system and medications only. Now, recently, only this deep brain stimulation. Deep brain stimulation initially used for only Parkinson's disease. As you all know, Parkinson's disease is treated by, in an advanced stage, was treated by deep brain stimulation. But nowadays, this movement disorder, especially neuroacanthocytosis, is managed by deep brain stimulation when it is not responding to the drugs. As I said, newer drugs has been approved by FDA for treatment of neuroacanthocytosis is Nutraside. Tetrabenazine was an older drug, and Nutraside is another new drug which is approved by the FDA for the treatment of neuroacanthocytosis. But the latest treatment approved is the deep brain stimulation. That is putting an electrode inside the brain and aborting the movements by stimulating the electrodes to the brain. Okay, so deep brain stimulation is a newer treatment which has been approved for the treatment of neuroacanthocytosis.
Okay, so thank you so much, Dr. Syamlal, for joining us today and giving us all your insights on this rare condition. Definitely, you had laid out different aspects of it, and it was very insightful from your end. So, thank you so much for giving us all your details about it.
Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.